If you're Black in America, you're twice as likely to die of COVID-19. Yet researchers are seeing a disproportionately low number of Black volunteers for vaccine clinical trials that could save lives. Ron Allen takes a look at what's happening.
Today marks a major milestone in the nation's fight against COVID-19.
In Savannah, Georgia, Dawn Baker not only anchors the news, she made huge headlines herself last month. She was the first volunteer as part of a phase 3 clinical trial in the U.S. to get injected with a potential COVID-19 vaccine, the final step before a drug can be approved.
You've had 2 doses.
Yes, yesterday, Monday was my second dose.
How are you feeling?
I feel great. I had the
no side effects.
My arm was sore, similar to when you get a flu shot.
Her private doctor for 30 years, who's involved in the study of a drug produced by Moderna, asked her to do it.
Had to make sure that it wasn't a live virus and that there was no way that I could get COVID-19 from being a part of the study.
After seeing so much suffering due to COVID, especially in the African-American community, Baker stepped up.
I've had friends who've lost very close relatives, people that I know. I've also had some friends who have passed as well from COVID-19. So it kind of made sense to me that, you know, instead of just being afraid, how was I going to be a part of the solution?
She's gotten a lot of praise and more on social media.
And as you told me, some people think you're absolutely crazy.
Of course they do. I mean,
what's your response to that?
Well, you know, I really have decided that, you know, being an on-air person, I learned a long time ago that you really can't read comments because there are going to be just as many people who love you as hate you. One comment was, you know, this sister isn't woke because she's worked for white people too long. She doesn't know they'll try to kill us.
Sounds extreme, but it's an example of the deep mistrust of the medical establishment that exists in the African American and other minority communities. And the reason researchers say they're having trouble finding enough minority participants in the COVID vaccine studies. So far, of some 360,000 online volunteers for vaccine trials, only 40,000 are minorities, much lower than their share of the overall population.
We want them represented in vaccine trials so that we can ensure that the vaccine works well in these populations, since they're most at risk.
What do you say to people who are mistrustful of this process and the medical establishment generally, and the government for that matter?
Yeah, I first start by saying I understand. I get it.
Dr. Stephon Wallace leads the effort to involve a diverse array of volunteers in the trials, especially from minority communities where the pandemic has hit disproportionately hard.
I think that the medical establishment has a lot of work to do to build relationships and build trust and to make amends for a lot of the issues that have occurred in communities over the years.
Wallace and other experts say perhaps no issue hangs heavier than the Tuskegee syphilis study. Beginning in the 1930s, some 600 men involved in a U.S. government study of how the then rampant disease developed if left untreated.
What was so terrible about that was, first of all, they were not told that they were being studied.
Lily Tyson Head's father, Freddie Tyson, back then was a sharecropper, devoted father of 8, and once a fireman at the airfield where the famed Tuskegee Airmen trained.
And they were not told that they had syphilis. And then when penicillin came out, they were not allowed to get the penicillin for treatment or cure.
No one knew the truth for some 40 years.
The Associated Press reported today the Public Health Service conducted a 40-year experiment on 600 people with syphilis and purposely denied treatment to 200 of them to see what effect this would have on the human body.
The U.S. government settled a lawsuit. Decades after that, President Clinton apologized.
What the United States government did was shameful, and I am sorry.
How much of your grandfather's experience is what's motivating you now?
So my grandfather and I were really, quite close. He helped raise me.
Granddaughter Carmen Thornton is a public health expert. Tyson's family hopes part of the men's legacy will be greater involvement by people of color in the medical community. They're encouraging volunteers to get involved in the clinical trials and every aspect of the effort to fight COVID-19.
What would you say to these researchers, drug companies, others who are trying to recruit people of color into these studies?
Nothing about us without us. There has to be involvement in very strategic planned approaches that include minority population and representation around that table when the plans are starting.
With several more phase 3 clinical trials about to get underway in the U.S. and tens of thousands of volunteers needed as soon as possible, drug makers and researchers say they're stepping up outreach, especially in Black and Latinx communities.
What do you think is at stake now for the Black community?
Well, it really is a matter of life or death. I hope that people would really consider it, because really we have to get something done. And all the experts say there really is no way out of what's happening now unless there is some kind of vaccine.
There are now more than 6.1 million cases of coronavirus confirmed in the United States. The country's top infectious disease official, Dr. Anthony Fauci, says Labor Day will be an important test for getting our outbreak under control. He spoke to MSNBC's Andrea Mitchell earlier today about the current state of the pandemic.
Fall and flu season are now just around the corner. Is this a make or break moment? What is a realistic baseline number for where we should be on daily cases by the fall, just a few weeks out?
We're right around 40,000 new cases. That's an unacceptably high baseline. We've got to get it down. I'd like to see it 10,000 or less, hopefully less. The issue that we're facing right now is we're entering in a day or two right now into the Labor Day weekend. And we know from prior experience that when you get into holiday weekends, the 4th of July, Memorial Day, there's a tendency of people to be careless somewhat with regard to the public health measures that we keep recommending over and over again. So I really want to use this opportunity almost to have a plea to the people in this country to realize that we really still need to get our arms around this and to suppress these types of surges that we've seen. We can do it. You can have an enjoyable weekend, but you can do a couple of fundamental things that we talk about all the time. Masks, distance, avoiding crowds, outdoors much more than indoors, washing your hands.
The president said that a vaccine is possible before the election. Vice President Pence has said we are a nation of miracles. Is there a risk of promising too much or even of pushing an emergency use authorization for a vaccine before it has been fully proved safe and effective? And I know authorizations have been used in the past for vaccines, but that's the normal time frame of years of study for a vaccine and testing and randomized testing. And we've seen the push for emergency use before things are properly vetted.
Yeah, I mean, obviously, that's a concern of many people. Right now, if you look at the timetable of the vaccine candidates that we're involved with, we have 3 now that are in phase 3 trials. At least a couple of them are more than half completely enrolled. So things are really right on target. As I've mentioned many times, and there's no reason for me to change this projection, I think we'll know by the end of this year, November or December, that we do have a safe and effective vaccine, and I'm cautiously optimistic.
The president was discussing vaccines on a Fox interview on Monday, and he then said, once you get to a certain number, we use the word herd. Once you get to a certain number, it's going to go away, so it doesn't have to be. Are they still at the White House? I know that some of the advisors have said that they're not doing this, but are they talking about herd immunity and the risks, though, that are associated with that kind of rhetoric about herd immunity somehow making us all safe, getting enough people sick?
Well, I think you got to explain to the viewers what herd immunity is. Herd immunity is that when you have enough people who've either been infected and or vaccinated and protected, that there's enough protection in the community that the virus doesn't have the capability of freely being transmitted from an individual to individual. You kind of have the herd protection as an umbrella. We're not there yet. That's not a fundamental strategy that we're using. The fundamental strategy that we clearly articulate and go by through the task force is to try to prevent as many infections as you possibly can prevent. That when you get someone who's infected, you do the identification, isolation, and contact tracing, and you do the kinds of things to prevent infections, the things that I've just been speaking about with you when we were talking about trying to make sure we don't get any surging of cases over the Labor Day weekend.
Oxford University and AstraZeneca say they're getting into the final phase of their testing for their coronavirus vaccine. Phase 3 of clinical trials are set to begin as early as today in the U.S. NBC News senior medical correspondent Dr. John Torres joins me now. Dr. John, all right, that sounds like promising news on vaccines today, but a study from scientific journal Biostatistics actually says vaccines for infectious diseases have a 33% success rate of making it through clinical trial. Realistically, where are we in the race for a vaccine?
And you're right, and I frequently talk about this. When you look at drug trials, when you look at vaccine trials, the road is paved with drugs and vaccines that got through phase 1, phase 2, and then failed miserably in phase 3. The difference here is that they're looking really hard at the data they're coming out with, and they're using that to push forward on these other phases. And the data we're seeing so far looks promising as far as its safety and its effectiveness. But now, again, phase 3 is a different type of trial because here they use 30,000 people. Like Dr. Fauci said, some of them are almost halfway through enrolling those people. So they still need to enroll the people. They give them the vaccine. They check to see whether they got the virus, if they got the virus, whether they had complications from it. And then they crunch the numbers. They look at the data to make sure, number one, that it's safe, but also that it's effective and it's doing what we want it to do. You know, what Dr. Fauci said, and a lot of experts are now saying too, is they think we'll have the vaccine by the end of the year, at least for the emergency use authorization part of it. And that typically means that that's when it's going to start getting into that phase 1 of distribution. Those essential workers, those critical workers in the front line in the health industry, those with pre-existing medical conditions, those that are elderly who are at high risk of complications, because that risk is dangerous enough that the benefit of the vaccine could certainly help out. But I think for the rest of us, realistically, we're probably looking at late winter, early spring timeframe before we get this vaccine in the general public.
Wow, that's still not too long off. Still sounds kind of hopeful. I know a lot of hope for a vaccine rests on how long these COVID antibodies last after someone is infected. And we've heard a little bit about people being reinfected. Are we getting any new information about immunity after having the virus?
We are getting new information. It's actually encouraging information because, like you said, over the past couple months, we've had stories go back and forth on different studies looking at antibodies, how long they last. And in some instances, we've heard in some studies that people with slight symptoms or who are asymptomatic, their antibodies tended to go away after 3 months. Well, this new study is looking at it, and it's a more robust study, and they found that 4 months later, the antibodies are still there in people who are infected with coronavirus. So that's good news. On top of that, we know that our immune system can sometimes essentially go to sleep a little bit, but then wake up real quickly once the virus hits our body because of these things called T cells, a different part of our immune system. And so this is all giving us hope on 2 different paths. One, that we have if you had coronavirus, you get those antibodies, that immunity is going to last longer than we thought it was going to last. And number 2, for the vaccine, it's making it likely the vaccine might be a once or twice type vaccine instead of having to get them every year like the flu, Savannah.
Let's talk about treatments. Now, what if you do get sick and you need to be treated? There are these new trials out showing that steroids can help the sickest COVID patients. What do we know about that?
You know, which is an interesting thing because steroids have been used since the day I walked in the hospital. I've been using steroids. They're very inexpensive. They're ubiquitous. They've been around for years, for decades. And we've looked at different drugs for coronavirus throughout the months. Hydroxychloroquine, if you remember, that didn't work out. Remdesivir, it looks like it can help lessen symptoms and get people out of the hospital sooner, but we're still looking to see what it does as far as controlling the death rate. Steroids are the only ones so far that looks like it can actually help people, help prevent them from dying, lower the risk of dying. And it can lower the risk substantially, but only for people who are critically ill. And I think that's the important message to get out here. Steroids should not be used for people that only have mild symptoms or even moderate symptoms, because it might actually make things worse. But for those that are critically ill, this study looked at a variety of other studies, looked at thousands of people, and found out that for critically ill people, those steroids, especially dexamethasone, really help keep things under control and cut their death rate down. And again, that's the one drug we have right now that looks like it's doing that.
Such good news just to hear that anything is doing that and cutting that death rate down. Speaking of the death toll, there's a lot of confusion this week about what that number actually looks like after the CDC said only 6% of the nation's total reported COVID-19 deaths were actually from the virus, and the remaining percent died of, quote, other serious illnesses. Can you clear this up for us?
And I can clear it up, but I can at least try to clear it up because it can be very confusing. And what they said was that 6% died from just the virus. They could not find any other reason for them passing away. But the other 94% died from other medical conditions that were worsened because of the virus. And the way I explain this to people is that if you think about it, during the flu season, hardly anybody actually dies from the flu virus. They typically die from complications of getting the flu virus. It could be pneumonias, it could be a blood infection called sepsis, kidney failure, but those would not have happened if they had not gotten the flu. Same thing here. We're seeing the same thing in that 94% of people who die from sepsis, they die from excessive blood clots, they die from pneumonias, kidney failure, but they would not have had those if they had not had coronavirus. So to say that only 6% died from coronavirus, that's a misstatement. All 100% of those people died from coronavirus. It just depends on whether they had other conditions or other existing health problems that were exacerbated that then led to their death because of the coronavirus.
Yeah, that totally makes sense. But it is the coronavirus that either got them that sick or led them to being in the hospital or whatever. All right, John. Dr. John, thank you so much.
You bet.
If you're Black in America, you're twice as likely to die of COVID-19. Yet researchers are seeing a disproportionately low number of Black volunteers for vaccine clinical trials that could save lives. Ron Allen takes a look at what's happening.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.